Can you take Buspirone as needed for anxiety? If you're managing anxiety and your doctor has prescribed Buspirone, you might be wondering if you can take it only when you need it. Let's break down the details to help you understand how Buspirone works and whether it can be used on an as-needed basis. Buspirone, also known as Buspar, is a medication that helps reduce anxiety symptoms by affecting serotonin and dopamine levels in the brain. It's commonly used to treat generalized anxiety disorder and can also be beneficial for other types of anxiety. When it comes to taking Buspirone, the general recommendation is to take it regularly to allow the medication to build up in your system over time. This is because Buspirone works best when it's taken consistently, usually 2 or 3 times a day. Starting doses can be as low as 7.5 milligrams twice a day, and your doctor may adjust this dose every few days until you find the right amount that works for you. However, some doctors do prescribe Buspirone to be taken as needed, especially for those experiencing intermittent anxiety attacks. In such cases, your doctor might advise taking a 5 milligrams dose once or twice a day as needed. This approach can provide flexibility, but it's essential to follow your doctor's specific instructions to avoid any potential risks or reduced effectiveness. It's important to note that taking Buspirone as needed might not be as effective as taking it regularly. Buspirone requires a multi-week or multi-month trial to fully assess its efficacy, and consistent use is generally recommended for optimal results. In terms of safety, Buspirone is generally well tolerated, but it can cause side effects like dizziness, nausea, headache, and drowsiness. It's also important to avoid alcohol while taking Buspirone, as it can increase drowsiness and dizziness. To summarize, while Buspirone can be taken as needed for anxiety, it's crucial to follow your doctor's advice. If your doctor recommends taking it as needed, it's likely because they have considered your specific situation and believe this approach will work best for you. Always discuss any concerns or questions you have with your healthcare provider to ensure you're using the medication safely and effectively.